All right. Good morning, everyone. Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractic physician at Gates Brain Health. Today, I'm talking about mast cell activation syndrome and testing. This has been a very requested video. It's been requested several times by many people online and many of my patients. So I put this presentation together. I hope it's helpful for not only my patients to understand, but all of you out there to understand that testing for mast cell activation syndrome kind of has a differing approach, whether we're concerned that it's a cancerous condition or if it's something more benign affecting someone's chronic health. And that's the confusing part about mast cell activation syndrome, because it's almost a continuum where it may be the responsible issue for someone's gastrointestinal problems. It may be associated with chronic fatigue. It may be associated with horrible, unrelenting headaches. It also might be cancer. And when you throw that word out, a lot of people get scared, of course. And this is what doctors live with all the time. We're trying to make decisions. Is this person healthy, or do they need an adequate referral? So with that in mind, read the disclaimer, pause the video. None of this is medical advice. Listen to your doctor. This is food for thought for you to talk to your doctor about, conversations to have with them. And so hopefully this facilitates some of those discussions. Okay, so the title of the presentation. Okay, now I'm going to show this on stream. I love this breakdown. This is from an article by MJ Hamilton, who I believe works in gastroenterology and potentially allergy. In this article, it was broken down all of the symptoms in different body systems that one can have with mast cell activation syndrome. And good morning to everybody who's joining. So with the skin, a person, and I'm going to go kind of slow on this. Usually I kind of go through bullet points a little faster, but I'm actually going to go slow. So with the skin, you can have flushing, pruritus, which is itching, sweating, or urticaria. I'm going to show you pictures of urticaria, which are basically, you think of them as hives. And this is really big from the doctor's standpoint in differentiating something ominous, meaning kind of scary, versus something that's just more benign. Air passageways, so rhinitis, sinus problems, runny nose, throat itching, throat swelling, dyspnea, that's wheezing or difficulty breathing, and then wheezing, which is your standard wheezing. Gastrointestinal, and actually let's pause on that, because a lot of mast cell patients have troubles with breathing. Now, certainly, if someone has trouble breathing, they need to see their doctor. Maybe they need to go to the ER. That needs to be fully evaluated. In the context of mast cell activation syndrome, most of the time, all those investigations have been done. Most of the time, someone like myself is dealing with chronically ill people who are having these symptoms and don't have an explanation. And that's really kind of how Dr. Lawrence Afrin, who wrote the book that I mention every week, Never Bet Against Occam. He's a hematologist working in an academic medical center, and he's getting referred all these chronically ill individuals that doctors don't know what is causing their symptoms. And that's how he came upon the realization of this mast cell activation syndrome. So continuing on, gastrointestinal, abdominal pain, diarrhea, really common one, nausea, bloating. How many people out there have chronic nausea and they don't have an answer for it, and they're taking proton pump inhibitors, or maybe they're taking something like Pepcid AC and they're still having nausea, they're having MRIs of their brain, everything is normal. Well, maybe they have mast cell activation syndrome. Abdominal bloating, really common one. We used to just attribute abdominal bloating to small intestinal bacterial overgrowth from a functional standpoint, or maybe gastroparesis, or maybe lack of stomach acid to break down foods. So abdominal bloating can be seen with mast cell activation syndrome. Cardiac symptoms, palpitations, tachycardia, fast heart rate, pre-syncope or syncope. Pre-syncope basically means you're about to faint. Syncope means you did faint. And Dr. Afrin mentions several times in his book, as he's going through histories, he starts asking individuals, do you have a history of fainting? And a lot of the patients were shocked that he knew that they had some history to suggest that, because this is a common symptom in mast cell patients. I will say a common symptom I'm running into are individuals who run into walls, or they kind of stumble and fall over, minus, in the absence of some brain issue affecting their cerebellum, a tumor, a stroke, something like that. I'm seeing common symptoms of that in my mast cell patients. Neurologic symptoms, headaches, paresthesias, that's numbness and tingling. Memory issues, concentration difficulties. I just did the talk on brain fog. Moving down, skin dermatographism. That's where we take a pen, more like a Bic pen, and you scratch the skin. Some people use their fingernail. I like to use a pen. You don't scratch it hard enough to draw blood, but you also apply a fair amount of pressure to see, does the skin turn red? And if it turns red and it stays red after 10 minutes, then that person probably has dermatographism. And what I've seen, sometimes even like when I'm doing my neurological exam and I take a pinwheel down someone's arm, you can see all of a sudden this bright red texture that comes to the skin where the pinwheel touched their skin. That's an indication that their mast cells are way too overactive. Gastrointestinal, wait. Okay, we went through skin. Flushing over the face and chest. How many people report that? Okay, and now we're going at typical mast cell activation signs. I jumped over that. So the dermatographism is something that doctors are looking at. Signs are things that present in an examination. Abdominal tenderness on examination. Tachycardia when we're listening to the heart. Typical mast cell activation triggers can include heat and temperature changes, stress, alcohol, strong odors and perfumes. Let's see, let me hide this one. And certain drugs like morphine, non-steroidal anti-inflammatories, antibiotics. So I really like this breakdown because it helps us all to understand that one mast cell activation syndrome is not the same as the other mast cell activation syndrome patient. Meaning some people are going to present with chronic fatigue, itching, and they may have some abdominal bloating. Other people are going to present with urticaria, rhinitis, a history of asthma. Other patients are going to present with headaches, and maybe they have some presyncope, and maybe they have occasional nausea. All these presentations are so different, which is why so many people have a hard time wrapping their head around mast cell activation syndrome. How can this one thing cause symptoms in so many disparate parts of the body? And again, that's kind of like leaky gut syndrome. I hate the word. I wish that was not the word that was used. Intestinal hyperpermeability is a way better word. But what we have found since maybe 2005, maybe 2002, is that the gut has tremendous connections to multiple systems in the body and may be responsible in part or mostly for several chronic health issues, metabolic diseases, and or autoimmune diseases. So mast cell activation syndrome is kind of a similar type of phenomena where you have this mast cell activation potentially presenting epidermal symptoms, respiratory symptoms, cardiac symptoms, GI symptoms, and neurological symptoms. Okay. So this is a picture of a patient who has urticaria. You can see they look like hives. We've all seen movies like Something About Mary. That's a classic example where the gentleman, when he was nervous, he would get hives all over his skin. And so I've had hives. I have a history of allergies. So that is what urticaria standardly looks like. Compare and contrast that with this. This is urticaria pigmentosa. So when you're reading about mast cell activation syndrome, you may read about urticaria pigmentosa. Know that that's very different from what I just showed you, different than that. So these are your standard hives. I'd show this in stream. This is what urticaria pigmentosa looks like. There's actually different presentations, but basically these are dark colored, itchy hives that tend to be in large number in many areas of the skin. When a doctor sees something like this, it indicates to us something different is going on in the body than the previous picture I showed you with the urticaria. Okay, so now it comes to testing. And again, a lot of you get worried because you're reading about mast cells and you read about systemic mastocytosis, cutaneous mastocytosis, and do I have that or do I have mast cell activation syndrome? Then you're reading that a lot of people say mast cell activation syndrome isn't real, because I will tell you mast cell activation syndrome is kind of akin to fibromyalgia in 2000 or 2005. So you're going to be met with a lot of criticism. And I've talked to other doctors on the phone about this mast cell issue, and some of them being hematologists, some of them being in the allergy and atopy world. And they're really not concerned about mast cell activation syndrome unless they see something like a high tryptase. Oh, give a little shout out to my favorite gym in the world, American Iron. Now, suspect clonal versus suspect non-clonal. So most people that I'm working with have non-clonal mast cell issues versus the clonal issues are where our antennas stand up on the doctor's side, and this is what we have to make sure something really bad isn't going on. So the first blood test we do is called a serum tryptase. The serum tryptase will be high at any time in someone with a clonal disorder generally. Again, consult with your doctor on all this, but generally serum tryptase will be high at any time. We also may do something called the KIT mutation analysis. Many of you have read about that. You don't have to have a positive KIT mutation analysis to have mast cell activation syndrome. A lot of people with mast cell don't have that, but a KIT mutation analysis, when a positive mutation, may indicate that there's something genetically wrong going on with the programming of the mast cells. We had a great question. What is tryptase? Tryptase is a marker that basically mast cells, when they're activating, lead to high tryptase activity. Tryptase involves tryptophan metabolism. So these mast cells are taking all of these different compounds and creating things like histamine, creating tryptase. So tryptase is the one blood test that we use to really kind of differentiate between clonal versus non-clonal mast cell disorders. So in essence, the tryptase will be high. It's going to be high at any time. In non-clonal disorders, tryptase is going to be normal at baseline. It may be abnormal, particularly 1 to 2 hours after an episode, up to 4 hours. So let's say someone just, I had the experience a few weeks ago. I ate a cashew butter cup and all of a sudden my throat started swelling up. My stomach hurt really bad. Breathing became difficult. And so perhaps if this happens at 9 o'clock on a Saturday night, but let's say I went into the lab and I had my blood drawn, there's a probability that my serum tryptase would be high. Another option is for you to run a serum tryptase on an individual when they're having an episode, and if there's a 20% increase plus 2 nanograms per milliliter elevation of the tryptase from their baseline level, that can indicate mast cell activation syndrome. So let's say your doctor runs a tryptase on you and your tryptase is 10. Usually anything over 11.4 I think is high. So your tryptase is 10, and then you go out, it's a Saturday morning and you're weed eating and you're cleaning, and all of a sudden you start sneezing and you have urticaria. You say, okay, I have an order for this lab. I go into the lab and now my tryptase is, just using this example, now it's 12, maybe it's 12, 13, 14. That would constitute something like mast cell activation syndrome. Or another example would be if it was 5 and now it's 7, you know what I mean? Now we're thinking, okay, this looks like mast cell activation syndrome. you go over, show that in stream. Okay. So I do have patients where the tryptase is between 11.4 and 20. And usually in that setting, we're going to retest. This is still suggestive of non-clonal mast cell disorders, kidney diseases, asthma. I have a history of asthma, hereditary alpha tryptosemia. Other disorders can cause elevated tryptases in this range. So I just feel that's important to say because many of you who watch these videos are going to say, oh my gosh, I had a tryptase of 16. Well, talk to your doctor about that, but usually 11.4 to 20 is not super worrisome, but over 20 on 2 occasions, now it becomes worrisome. And we need to, in that setting, I refer patients to a hematologist. And the patients I've seen with systemic mastocytosis, they're high all the time, irrespective of circumstances. So they're well above 20 or they're 20 and above. So hopefully that helps in the understanding. And then the other tests for mast cell activation syndrome. So aside from tryptase, we do histamine blood tests, histamine urine tests, and methylhistamine 24-hour urine. That's one I particularly like because with the 24-hour urine measurements, you can actually see what's happening throughout the day. Again, I mentioned you may have the instance where you're totally normal when you're eating breakfast and you go out and you weed eat in the yard and you're sweeping up dust and your histamine can elevate. So the nice part about a 24-hour urine is that you're potentially catching some of those elevations in the mix of the normality. Prostaglandin D2 urine, KIT mutation, others include, let me see here, the serum tryptase, excuse me, the chromogranin A serum, the serum and urinary metanephrines. And my reference for this is Never Bet Against Occam from Dr. Afrin. So I hope this is of help. I think there probably is another broadcast in order to talk about when you go to the lab for mast cell activation syndrome testing, because not many lab technicians are used to doctors testing for this. Also, there are specific preparations for each one of these tests. So what I've started doing is oftentimes I'll send the patient to the lab with these specific instructions on how each test needs to be handled. Does the specimen need to be frozen? Does it not need to be frozen? Does it need a certain preparation? Those are really, really important for mast cell activation syndrome patients. Super important. But hopefully, in summary, you can kind of understand what your doctor may be looking at if you talk to them about mast cell activation syndrome. The first thing they're going to think is, okay, well, I learned about systemic mastocytosis. I learned about cutaneous mastocytosis. If you're an adult patient, there's also pediatric forms of mastocytosis. So they're going to say, okay, well, I know to run the tryptase. And so running a tryptase may be normal. So they may say you're completely normal. Hopefully, if it's abnormal, then the other steps in the process come into play. If it's over 20 on 2 occasions, you need to see a hematologist. But you may say, hey, I'm having chronic symptoms of XYZ, fatigue, bone pain, gastrointestinal problems, headaches, trouble breathing. You've seen the cardiologist, pulmonologist, all that's been rolled out. Well, then here are the other tests to consider. And if some of these other tests come back positive, that can be supportive evidence that maybe you have mast cell activation syndrome. Also keep in mind, as Dr. Afrin mentions, lots of times you got to keep retesting. Even for these markers, it's not just a one-time deal. I oftentimes just keep retesting patients and I see that the numbers can go up with different provoking factors. Maybe you eat a food, maybe you had a recent infection that's been paralyzing the world for the last number of years. And maybe that's raising some of these markers. So that's the talk for today. Thank you all for joining. I hope I answered the questions well. And I probably could use, on this question, what is tryptase, I probably could use to bring in a diagram of like the mast cells releasing histamines, releasing interleukins, releasing tryptase, how all those chemicals are kind of produced within the mast cells. And I'll keep that in mind too. All right, everyone. Have a good weekend.